A medical lab scientist from the University of Abuja Teaching Hospital, Steve ORICHA, joins us right now from our Abuja studios. We'd like to thank you for joining us on the program.
Thank you, Millicent, for having me.
All right. You've been involved in the pandemic response, but first I want to get your opinion on the Salah celebrations and what we were seeing, looking at the reports before now, crowds and the absence of physical distancing. It appears that compliance is still an issue. Is there any other better way to enforce them?
For me, I truly think there is no better way. Until Nigerians begin to take responsibility for themselves, we'll keep having this problem of having to beg. I'm surprised at seeing even state governors just disobeying the laid down simple rules of social distancing. It is not encouraging at all. Where we see some Eid prayer grounds being empty, we saw some just now from the news card, just crowded, and it's truly is saddening for me. And we can't continue this way, because if we do, we have a long way to go. Millicent.
Do you think that it's a case of people not understanding the gravity of what COVID-19 is?
Do I really say they don't understand, or people just decided to pay blind eyes, you know, or feign deaf to some of these things? Nigerians are seeing. We're watching on the television, even though, yes, we're not seeing visuals of those in our isolation, but I don't believe anybody in Nigeria today will tell you that COVID-19 is not real. I truly don't think so. I want to believe, every Nigerian believes that COVID-19 is real. So it is not about Nigerians not knowing. I want to believe they know. Yes, what do we do? Maybe keep sinking it and keep our advocacy high, letting people know that this thing is real and it's not the respecter of anybody.
So let's talk a bit about testing. We understand that you are also handling the GeneXpert machine, which is one of the machines used for testing for COVID-19. Please explain the process and how it works.
Okay, I'll just tell you the basics. The processes are not what we'll sit down here to talk about, but it's been very good, and for me, it is quite exciting that the government of the day is really looking at that direction. If you notice, which I commend the NCDC for, really, at the onset of COVID-19, we had 5 laboratories, public laboratories, testing for COVID-19, and today we have about 33, and Federal Ministry of Health and NCDC introducing the COVID-19 method, introducing the GeneXpert method for testing for COVID-19 is quite commendable. For me, it is looking inward. It is easy, it is faster, and it is less expensive. And by the way, as I said, if we can only look inward, we will test more people. Right now in Nigeria, we're testing 1 to 8,000. Which is saddening for me. Ghana here is testing 1 to 80. Rwanda is testing 1 to 50. What is the magic? We can do it here. How? Right now, as I speak to you, the GeneXpert model that we're using right now in Google that are approved for us by the NCDC and the Federal Ministry of Health, we have over 400 of it in the country. So what we need to do is for the federal government to build up capacity for these GeneXpert machines that we have in the country, buy the cartridges, and start testing, because the more we test, the more we're able to isolate, the more we're able to treat the people, and, you know, we'll bring this pandemic to a halt in no distant time. But if we want to concentrate on building mega labs of PCR labs that will take millions of naira to complete and to equip and all of that, we'll be wasting our time. The GeneXpert model is there, as I said. It is very easy. 2 hours max is a working system. Take your test done, and you get your results. So for me, I want to appeal to the federal government that we need to do more. We have these GeneXperts in the country. All we might need to do for some of them, train the people, buy the biosafety cabinet that is needed for some of these laboratories, and before you know it, we'll bring this thing to a halt.
So that's the thing. I guess perhaps it is time that is of essence right now, and perhaps also that the federal government need time to buy all the things that are necessary, because they have talked about scaling up testing and with the use of also the gene expert machines that exist across the country. But the thing is, how much time do we have? Do you think that the process takes quite a long time, and this is to scale up capacity across the states?
I truly don't think it should take us time. We have the manpower. We have medical laboratory scientists scattered all over the country. For me, all we need to do, as I said earlier on, keep the ball rolling. The gene expert machines are there. You are not buying a new one. All you need to procure are the kits. And the kits are not very expensive. Buy the kits is government to government. So that the issue of shipping, the issue of having to come and stay at the port and all of that is reduced. You know? So all we need to do is buy these kits, ship them into the country, and activate some of these sites that have already gene experts, which we're using already in country for the detection of tuberculosis, of TB. The machines are already there. As I said, I don't believe in building mega molecular biology laboratories.
All right, we appreciate your time. Thank you so much, Steve ORICHA, a medical lab scientist from the University of Abuja Teaching Hospital. Thank you for joining us on the program.
Thank you for having me around.